The U.S. government is cracking down on what it considers junk health insurance plans and on healthcare companies trying to skirt the law and surprise you with outrageous bills and fees. The president announced these proposed new rules today, and they include cutting short the amount of time you can have these so-called short-term health insurance plans, which can sometimes be less expensive, but could, surprise, leave you without coverage. Sometimes people purchase these types of insurance plans when they're transitioning between employers. Now, under regular Affordable Care Act health insurance rules, companies are required to cover pre-existing conditions, but that isn't always the case in some of these short-term plans, and people have been burned thinking they're going to be covered, but they're not. The Trump administration extended the amount of time that you could have these short-term plans all the way up to 3 years. Well, today, the Biden administration is proposing that they should be indeed short-term, and you should just have them for 3 or 4 months max. If you currently have one of these plans and this rule is ultimately finalized, you'll be able to stay on the plan until its expiration, and then you're going to be rolled into these new rules. The proposal also mandates that companies offering plans that cover you if you lose your income source must be super clear about how much your daily benefit would be if you got sick. For example, they've got to say, if you buy this supplemental plan and you get sick and you can't work, you're going to get $100 a day during your illness. And most importantly, the proposal says all insurance companies must clearly disclose the limits of the benefits in the plan you're buying. And when it comes to those surprise medical costs, the president is proposing ending what he calls abuse of the in-network designation. So if you've ever had to go to a hospital, you know, even if the hospital you go to is in your network and covered under your health insurance, you may still get a bill because your insurance company says, well, the doctor that was treating you in the hospital wasn't in network. The president's new proposed rule says no more of that. Healthcare service provided by these hospital providers are either out of network and therefore subject to surprise billing protections, or they're in network and subject to the Affordable Care Act's annual limitation on cost sharing. And if you've ever been hit with one of those facility fees from your doctor's office, the administration says your healthcare plan and your provider must now disclose all those fees publicly and must make them available to you so you are not surprised with a bill after you're treated.